support from nasal bone. In between anterior wall of sinus, it's not working, anterior wall of sinus and posterior wall of sinus also cortical bone. You can take a support from that. Otherwise, you have to take support from other bones like zygomatic and pterygoid. This is full mouth cases for a immediate loading purpose. Okay. So next one is cosmetic display. Cosmetic display for a full mouth or complete range வராங்க என்ன பாப்போம் jaw relationல சிரிக்க சொல்லுவோம், ask the patient to smile, ask the patient to speech, the lip line பாப்போம், lip show. So one patient is coming to us with a high smile line. Can we give only crown or we have to give a long crown? No, we can't give. So for that we have to replace processes crown and gingiva so that you know about degree of resorption. So what is degree of resorption? So first picture shows that the resorption should be only 10 to 12 mm. So if the resorption is 10 to 12 mm, you can give only teeth. 12 to 18 mm, you have to replace crown and gingiva. So above the 18 mm, you have to replace the both tooth, gingiva and bone. So above the 18 mm, 20 mm, you can't replace with the implant or fixed processes. You have to go with the removable denture, RPD or CD. Okay, this is called fixed processes classification. So now tell me which option you have to choose. First you have to go for looking for bone or final outcome of the processes. Of course, always you have to look for a teeth first, then X-ray, because without bone we can place an implant. So next thing is bone, then soft tissue. If your patient have any aggressive periodontitis or any lesions or soft tissue lesions, then you have to remove the lesions and you have to do a subgingival scaling, then you place an implant. Okay. சரி, இந்த மாதிரி ப்ராசஸிங் பண்றதுக்கு என்ன பண்ணணும்? ஸோ மெயின் திங் நம்மளோட ஃபர்ஸ்ட் நம்ம இனிஷியலாக போடும்போது பிரச்சனையே ஆங்குலேஷன் அண்ட் பொசிஷன். இந்த ஆங்குலேஷன் பொசிஷனை நம்ம அவாய்ட் பண்ணிட்டோம்னாலே 90% ஆஃப் இம்ப்ளான்ட் ஷுட் பி சக்ஸஸ்ஃபுல்லாக இருக்கும். அதர் இது காம்ப்ளிகேஷன்ஸ் இருக்கு, ஐ வில் டெல் யூ. ஸோ டு அவாய்ட் that situation we have to use the surgical guide. Surgical guide, of course, patient not affordable, patient க்கு நம்ம surgical guide பண்ண முடியலனா some things we have to use for a surgical guide. One is diagnostic wax up, trial denture. Diagnostic wax up already I showed that box wax up. அதுவே நம்ம place பண்ணிட்டு சென்டர்ல இனிஷியல் drill போட்டு angulationக்காக. So future outcome tooth நமக்கு முதல்ல தெரிஞ்சிரும். அதோட மிடில் இருந்து போகும்போது angulationஐ அவாய்ட் பண்ணிக்கலாம், irregular angulation. Second one is removable processes as well as sealing. In removable processes, before CPCT also we can make one RPD, removable processes, ask the patient to wear. In the tooth we can use some silver foil or something and send the patient to CPCT. That CPCT, in CPCT itself you can see the position and angulation of the tooth. So அதே RPD சென்டர்ல ஒரு ஹோல் பண்ண சொல்லி லேப்ல கேட்டோம் அப்படின்னா அதையே நம்ம என்ன பண்ணிடலாம் அப்படின்னா ஒரு சர்ஜிக்கல் கைட் மாதிரி அந்த ஆங்குலேஷன்லயே நம்ம பிளேஸ் பண்ணிடலாம் to avoid the irregular angulations. Okay, next one is retainers, SS retainers நார்மலா யூஸ் பண்றது. you can give a immediate loading within 3 days. 72 hours you can give a immediate loading. If patients having poor quality of bone, better you can avoid immediate loading and wait for 3 to 6 months. Upper maxima 6 months and mandible 3 months is enough. So you just ask the patient to come after 3 months and open the flap and give a delayed processes. Okay, so that time if you want more accuracy, இன்னும் நல்லா செக் பண்ணனும் அந்த ஸ்டெபிலிட்டி அப்படினா there is an instrument called resonance frequency analyzer. It's like more than lakh Austin, they have only Austin company தான் வச்சிருக்காங்க. That's called resonance frequency analyzer. The implant stability coordinate சொல்வாங்க. One device we have to fix the device in the implant. Another device நம்ம அந்த 12th ல பண்ணிருப்போம்ல tonic force மாதிரி just a magnetic force வந்து அது இன்டியூஸ் பண்ணும். அந்த magnetic forceல high stability இருந்துச்சு அப்படினா higher value வரும். So if more than 40, more than 50, your implant is good stability. Okay, after 3 months or 6 months, if you want good stability mechanism. Okay, next thing, impression technique. So how to take a good impression? So normally, நம்ம டூத்ல எடுக்கிற இம்ப்ரஷனுக்கும் ஒரு இம்ப்ளான்ட்க்கும் என்ன டிஃபரண்ட்? So normally for FPD or tooth cutting, நம்ம அந்த டூத்தை just டூத்தை தான் நம்ம ரிப்ளேஸ் பண்ண போறோம். Just டூத்தோட மார்ஃபாலஜி அப்படியே நம்ம ரிப்ளேஸ் பண்ண போறோம். But in implant we need to look for a position, angulation, and of course that implant should be submerged into the gingiva. So you need a good collar, emergence profile. So all should be come into the cast. Okay, so for the good impression, what are the materials, prosthetic materials we need? Okay, so impression technique, we have a two type of impression technique. One is direct method, it's also known as open, pickup. Another one is indirect method and also called closed tray or transfer. Abutment level is only full mouth. If you giving multi-unit abutments, so after implant placement we have to, for angulation we need to go for a multi-unit abutment. So that is abutment level. Normally single implant, so day to day life we have to take an implant level impression. Okay, so for that, what are the prosthetic components available in the market? First one is healing cap. After surgery, second surgery, we open the flap, remove the cover screw and place the healing cap. That healing cap available in the different sizes. It's come under the small, medium, like every system have each their own diameters and own length, 2 mm, 3 mm length available, and also width also 2, 3, 4 mm available. Okay, that is healing cap. Next one is analog. Analog is nothing, dummy implant. So implant we place an intraorally. We need something in the cast, right? So that is replica of dummy implant. Implant உள்ள இருக்கும், அப்பதான் அதுக்கு மேல we have to do a processes. So that is analog. It's also known as it is a dummy implant. Okay. Next one is impression coping. The impression coping, two type of impression coping is there. First one is open tray transfer. Okay. Second one is closed tray. It's also known as pickup. I already told open tray, closed tray. Okay. So what is the difference between these two coping? So first one is that open tray coping is lengthy screw is available and striation is available. This striation will interlock into the impression material. So you no need to unscrew. You no need to take away. It will come out with the impression material. Second one is smaller one. Smaller screws available, no striations. You have to take out. You have to pick up. So that is called pick up. Another one is, the first one is called as a transfer. அதுவே வந்து transfer ஆகும். உங்களோட காஸ்ட்ல வந்து அது வந்துரும். அதனால தான் அது transfer, open tray, direct method, இது indirect method. will be played. Second picture. After open the flap, we have to place the healing cap. As I told, the healing cap is available in many sizes. Which size is accurate for the patient? You have to choose it.